we thought it was really important and also very fascinating to talk about the menstrual cycle from a physio point of view and just trying to get some information out there for whoever wants to watch this and take away the evidence and what we're talking about, really. Definitely. So, quick disclaimer.
Oh, yeah. So this applies to people that have periods, so go through a menstrual cycle. Some of the things that we're talking about does apply to people that are taking hormonal contraception, but primarily when we're talking about hormone fluctuations, it's those that have normal periods, so don't take hormonal contraception essentially. On that note, the biggest takeaway, we're going to discuss the evidence and things that you can do to kind of manage, your cycle with exercise and performance. But the biggest takeaway I want you to have is everyone is different, and we know tracking your cycle helps. So just because we're discussing this doesn't mean it definitely applies to everyone. And the biggest thing is working out what's best for you.
Nice. Plinth high five.
Yes.
Oh, yes. So, Alice.
Mike.
Tell me and everybody, in a nutshell, what is a period?
So, when we're saying about periods, we're discussing the whole menstrual cycle. So the 28 days, give or take a few days either side, everyone's different, of hormonal fluctuations, which leads your body to then have a bleed, which is the period. But we're kind of discussing that menstrual cycle and the hormonal changes throughout. And we're going to chat a little bit about what's happening to your hormones when that happens, and what we can think about in terms of performance, exercise, recovery during those different fluctuations to kind of optimize us.
Perfect. So let's go on to hormones itself. What hormones are involved in the menstrual cycle?
So we've got three big players. So number one is estrogen, which is an anabolic sex hormone, which means it helps build. So it's good for building muscles, helps with protein synthesis, just
growth, repair.
Great hormone, yeah.
Awesome.
Second one is progesterone, which is catabolic, so it breaks stuff down, and it actually stops the production of estrogen a bit later on the cycle. We'll come on to that. Then testosterone, which we have a little sprinkling of during ovulation in our cycle. So another anabolic sex hormone, which helps strength, muscle, protein synthesis, helps empower us, makes us feel powerful. So and the two other hormones that I want to mention, which we won't really talk about, but just in case you hear them in passing, are follicle-stimulating hormones and luteinizing hormones, which again help in terms of the different stages within our cycle.
When do these hormones come about within the cycle?
Cool. So, great question. We'll start at the beginning, which is day 0. That's the first day of your period.
Yeah.
Actually, at this time, progesterone and estrogen are pretty low.
Okay.
This is when most women will report some form of symptoms. So I think it's 80% of women actually report symptoms during this time, whether it's pain, bloating, cramps, sleep disturbance, mood changes, and that's when you're actually bleeding.
Okay.
On average, 0 to kind of 7 days, give or take. Again, everyone's different.
Okay.
During this time, if we're thinking about kind of sport-specific performance or exercise, this is your time to be kind to yourself.
Chill out.
Yeah. If you're in pain, not sleeping well, don't really feel like exercising, pretty low energy, listen to your body, because we know hormonally you've got a little bit of change.
Yeah.
So it's a good time to think about, rest, recovery, exercise if it feels good. You know, exercise can help with some of those symptoms, but it's not a time to really be pushing yourself.
So even in a non-sporting perspective as well, people that go, let's just say to the gym or something like that, working hard jobs and things, and they're just generally stressed and tired and fatigued. If they're also going through that period, that's just like a double whammy. I'm just trying to say, do you know what? Take time, have that kind of period just to like settle down and chillax.
Yeah, bit of self-care.
Self-care, that's the better word.
So actually in terms of phases of your period, that's called the follicular stage.
Okay.
So early follicular is when you're bleeding. Then the second stage, late follicular, is a period of time prior to ovulation. This is when estrogen is on the incline.
Okay.
So like we said, estrogen's great. So it helps with strength, building of muscle, protein synthesis. This is a good time to be pushing towards
This is the time.
This is the time,
Go hit the weights, do your strength training.
Exactly, yeah.
Or any kind of high performance exercises that
push for those PBs, because this is a time where you can be building muscle and getting stronger. Estrogen supposedly also can help with sleep. So the time it takes you to get to sleep is quicker during this phase.
Nice.
So it can help with recovery as well.
Awesome.
Again, I will say this all the way through. Everyone is different. Tracking your cycle and the way you're sleeping, the way you're feeling is a great way to know how this applies to you and how to tailor your cycle to what you're doing. But from a hormonal perspective, estrogen is on the incline, so it's great.
So within that period as well, like you said, with things like sleep and stuff like that, you can really just kind of, if you really want to get into, you know, discipline and be like, right, this is the 1 week where I'm going to do as best as I can with the training, but also go, you know, maybe to bed earlier or things like that, and track your sleeping as well.
Yeah.
And things like that, just to be as
Definitely.
the optimal performance ability you can be, essentially.
Yeah.
Did that make sense?
I think it made sense.
I think it made sense.
Yeah. Third part, ovulation. So this is where estrogen is high, and then this is where we get a little bit of testosterone.
Okay.
Ovulation is actually really short, so it can be like 1 to 3 days, but pretty much it refers to when your egg is being released, and it happens over like a 24-hour period. So it's short, really
It's
short.
a very, very short period.
And obviously with testosterone, it's another anabolic sex hormone. So you, again, helping with building muscle, you can feel really energized, again, different person to person. And because of what testosterone does, it's your fertile window. So some people find that they want to have sex more during that time. That makes sense.
So would you say, and forgive me if this is, but is this like the peak time for any kind of performance? If estrogen is high, testosterone is high, would you say this is like a time for the best potentially? Okay,
but, and we'll come on to this, estrogen is high, and the limited evidence out there suggests that estriol, which is a type of estrogen, increases ligament laxity. So what evidence there is suggests that during this period of ovulation is when women or people that have periods are at more risk of ligament laxity injuries, so
which we'll come on to in a bit.
ACL injuries, So something to consider, yes, potentially a good time to be pushing that, but considerations that we need to have.
We'll go on to that in a bit more depth in a minute. So there's a couple more parts of the cycle.
So we've done ovulation, which is, you know, shut it down.
Yep.
Then progesterone comes into play. So once the egg's been released, progesterone comes along and suppresses estrogen production.
Calms it down, takes it down.
Takes it down a little bit. Progesterone is catabolic, so it breaks stuff down. So it can essentially break muscle down a little bit more. So not necessarily the greatest time to be building loads of strength.
Right.
Might be more a good time to push for, you know, endurance, working a bit more cardio, things like that.
Interesting.
Yeah, you've still got a bit of estrogen during that time, but something to consider. And this is your luteal stage. So during your luteal stage, estrogen kind of does this and progesterone's present.
Yes.
As you get towards, you know, your late luteal, so we're kind of looking, you know, 14 to 21, then 21 to 28 days during this period of time.
Like 2 weeks,
Yeah, exactly. Progesterone has been shown that it can disturb your sleep. So you might not be sleeping as well towards the latter stages. Also can increase things like fluid retention and bloating. So some women might report a bit of discomfort, especially premenstrually. So towards the end of your cycle before your period.
Right,
so all factors to consider in terms of training. So if you're not sleeping so well, you're feeling a bit tired, then you're not necessarily going to want to be shifting, you know, loads of weight at the gym or really pushing them.
But it's not like the first part of the cycle. So like you said, you can do a bit more like, that's your real chill out week if there's going to be one in like a month or something
when you're having your period,
And then this kind of later stage is more like, keep going at it, but just think about what kind of weights or performance you're doing, just take it down a notch, essentially.
Or just, you don't have to push yourself crazy hard. You've still got a good, like, you know, you've still got estrogen there, you're still able to recover, just slightly less because of
Because it's difficult if you're thinking about like a footballer, which we'll come on to in a bit, you don't really have that luxury.
Not many athletes can just like
and just in general, can just chill out. So, but I suppose it's just an important thing to have in the back of the mind of where one is in their cycle and what types of exercises might be a bit more beneficial in that stage. Yeah?
Exactly.
Was that all of them?
That's all of them, yeah.
Okay, cool. Fun fact.
Fun fact. So, periods are on the increase. So, the average woman has about 400 periods in their life, whereas like 200-300 years ago, most women had about 40.
40?
40, yeah.
What, in their whole life?
In the whole life. Yeah.
That's mad. Why?
Wow.
She wanted me.
So, the reason why is nutrition's better. Women are not working so hard, so manual labour was bigger then. So probably women weren't having their periods as regularly.
Okay.
You've also got to think women were having lots more babies earlier then.
Right,
so
okay.
pretty much you start having your periods, then you get pregnant.
And then
You
9
have no
months.
periods.
Yep.
And then you start breastfeeding for longer. And then you have your periods again, then you get pregnant again. And then obviously people would die earlier.
Wow, that is a fun fact.
It's pretty cool, isn't
That's
it?
a really fun fact.
So
So coming away from obviously talking about the cycle, a bit of training, things to think about and stuff like that, how can that, which we already briefly touched on, influence or have an impact on things like ligaments or injury in itself?
So we've obviously mentioned that when you're ovulating,
Yeah.
when estrogen is high, potentially there is evidence of increased ligament laxity. So
Yeah.
predisposition to things like ligament injuries, particularly in women or
Yeah.
people who have periods, ACL injuries.
Yeah.
Now, there is a fair bit of evidence to suggest that this is the case, but all of that evidence concludes that they need to do more evidence. So none of what we're working with is good quality evidence.
Yep.
But especially, with the Women's World Cup, as women's football is getting more and more popular, which is great, we are seeing more ACL injuries in that population.
Yeah.
And that's something that we need to consider. It's not just to say, your hormone fluctuations are the sole cause of that, but they are things that we need to consider in addition to all the other factors that can, increase your risk of ACL injury.
And let's go through some of those factors. So we've got obviously taking into consideration the hormonal potential aspect of laxity that can cause maybe an ACL injury or other injuries, of course. But let's kind of like segue into football specifically. Women's World Cup, Lionesses, let's go. There are many more factors involved as well. For example, let's talk about biomechanical factors.
Of course. So, I remember at uni learning about the Q angle.
Q angles.
Women have a bigger Q angle of their pelvis, which can then increase your knee valgus. Whether or not that's still, I think we do know that pelvis shapes are different in women.
Yep.
And it is going to increase the way or change the way that you land. Potentially the stability of your knee in landing, and especially pivoting, twisting sports, it will have a contributing factor. We've also got to think about strength and control. So
100%,
we often look at the quads hamstring ratio. Now, if you've got particularly a change ratio, so your quads are particularly strong in your hamstrings or vice versa, that can be a predisposing factor to injury as well. And obviously muscle power in general, if you've got reduced power in your lower limb, that's a contributing factor. Thinking about hypermobility as well.
Okay.
So we look at doing like a Baton score, for example. But if someone is more hypermobile, which is more prevalent in women, that in itself is again a risk factor.
At that stage as well, maybe in that kind of
Potential, but there's no evidence to suggest that
so
as of yet.
Scrap that.
But just in general, joint hypermobility syndrome is more prevalent in women, and that is a risk factor for ligament injuries.
But it's interesting. When looking at some of the evidence, I looked at the British Orthopaedic kind of Association, and then using some annual reports on ligament kind of repairs and stuff, ACLs, just generally in the men's and women's kind of populations. Like football is the biggest one, like nearly half of them. It's called like ACL injuries come from football, and obviously with women's football on the rise. At the moment they're not the highest, like skiing and netball at the moment are, but we can imagine that is going to increase, unfortunately. But also in a way, it's encouraging to see that we are getting more women into football. And fun fact,
water can stop your flow.
What?
Water can stop your flow.
Drinking?
No, water can stop your. Oh no. Like if you're submerged in water, drink more water, guys.
Please hydrate.
If you're in a swimming pool or in a bath, the water pressure on the outside is greater than the force of gravity.
Physics.
So, physics. So you will stop bleeding during that time. So this is really important because lots of women don't feel comfortable to swim when they're on their period. But essentially...
Oh, interesting.
Yeah, because obviously you're like worried about getting out of the pool, you're bleeding everywhere, bleeding for a tampon, but you're not gonna bleed generally when the water pressure is higher. It's good, isn't it?
Fun fact.
So you can...
That was a good one.
Swim,
Cool.
Yeah.
You can swim.
You can swim. Swim away. And actually, final fun fact, when we're talking about swimmers.
Right, okay.
So, obviously, we know that women generally are not going to be as strong as men. Right?
Okay.
You know, bone density, muscle-wise, hormonally, we are not built to, you know, have as big a muscles or as be as strong as men. However,
I was going to say, I beg to differ because you can definitely lift more than men.
Well, you know, I think that says more about you.
Yes, well.
So, ultra endurance swimmers. Because women have higher levels of body fat than men,
Right.
in swimming, when we're talking really, really far distances, women can manage their energy levels better, so generally can outperform men at longer distances because they can use their body fat more effectively.
Fun fact.
Yeah, which is really cool.
And stuff like that. But so then that kind of brings us on a little bit to, you know, if we've talked a little bit biomechanics, really important to like focus on things like landing, but also deceleration, cutting, taking into a little bit account the limited evidence we do have in the hormonal aspects. We've got other things like environmental stuff and disparities between the male and female populations in sport. Should we talk a little bit about them?
Yeah, definitely. I mean, you think about, for number one, like Women's Super League, you've still got women who are having to work full-time or part-time jobs to fund them being able to play football. Whereas you look at the average Premier League football player, he is definitely not having to do that.
Yeah.
And so that's massively different in terms of you go to work, then you go to train, then you've got matches on the weekend.
Yeah.
Other things to consider are medical teams. So some of the top women's football teams have a doctor that drops in on them once a week, and they might have one full-time physio, and that's the top, compared to your average men's team who has a full-time doctor, and then, you know, they might have 3 physios, soft tissue therapists.
Or even academies, even down to the ages of like, I don't know, 14 and below. They do have physios around them all the time, on tap, strength and conditioning coaches, nutritionists, and I know women's football is definitely making progress in those areas, and it is still progressing, so we just want to say that's not, you know,
they're doing a great job.
They're doing a great job,
but it's still different.
It still needs that kind of input, and I think if we're trying to encourage and promote women in football especially, we need to have that right environment from day one, from grassroots level, to try and focus on things like movement patterns, which you get when you're in those early stages of, you know, growing up and playing football. You learn them then, you know, and also footwear, boots. There's some evidence at the moment, isn't it? It's all been kind of geared around male football.
Yeah.
I haven't actually looked into that evidence much, but I know it's been talked about recently in terms of, you know, female having their own style of kind of footwear and stuff like that to meet their needs, which is super important. But like you said as well, pitches. Not having maybe, you know, experienced, let's just say, coaches, and just not having the access to things that maybe the male sport does have. Fun fact.
Fun fact. So estrogen can make you smell good, supposedly. Or when you're ovulating and your estrogen's high, it makes you smell good to males whose testosterone then increases, which is kind of gross if you think about it, but interesting. I think the actual smell doesn't change, but
there's something in the air.
Chemically. Yeah, mad.
Okay.
Yeah.
But also we want to talk about, you know, we've got a few considerations there, like we said, biomechanics, the hormonal aspect, the environment, but also the workload.
Yeah.
I think that's probably one of the biggest ones as well, really. You know, if we look at football now, how much we are playing and how much we're asking of people and how much that might have an impact on it. Should we talk a little bit about that?
Yeah, completely. So obviously we've mentioned the fact that a lot of female footballers might actually have to go to work and then come train. And that's all really, really important. We've also got to think about how, I suppose, injuries occur, and often that can be overloading. It's putting a bit too much load through a joint, through a soft tissue, which can then lead to injuries. And if we're not having adequate rest, we're not, you know, getting enough sleep, we're not adequately taking in enough nutrition, that can all have an impact on that.
Yeah.
And especially, I suppose, on the matter of periods, we know that women can be susceptible to, well, and men too, but relative energy deficiency syndrome. So if you're getting a nutritional mismatch, you're not getting enough nutritional intake to match your energy output, your periods can disappear. It can put you at risk of bone density and issues like that. that can be a sign of, you know, working too much. But how widely is that known?
Yeah, I mean, we come across that a lot in our profession, just not even in football, but just mainly in runners and athletes, in male and female as well. So it's definitely an area to think about in that regard. So I think, like, kind of concluding what we talked about, obviously periods being the main topic of today, but also it's really important to look at those other considerations when we're talking about sports and injuries and how that might all impact. I think the main thing to take away is prevention.
Yeah.
Should we talk a bit about prevention?
Yeah, we can talk about prevention.
We can talk about prevention.
Love it. Yeah. So I think a big thing, which comes back to what I've been saying, so for women or people that have periods specifically, is track your cycle.
Yeah.
Look at the fluctuations. Are you particularly tired? Are you feeling rubbish during these particular times? Can you adapt your training for that? Potentially a way of reducing injury risk and optimizing your performance.
Yeah.
So that's a big thing. It's also, as we've said, looking at in elite sports, but also sports where you're doing a lot, making sure that you're training appropriately, giving yourself adequate rest. Also thinking about things like sleep, nutrition, mood, how they impact on your performance, how they impact on your training.
Yeah.
All really, really important.
Yeah, and I think, like, what we do here at LDN as well is, like, we obviously see people with injuries, and that's most likely the time that people obviously come and see a physio. But if we had it our way, we'd prefer to see people prior to anything, hopefully, so then we can actually just go, right, this is how you can move better, this is how we can get you stronger to meet the demands of whatever sport you're in.
Yeah.
We can use things like awesome statistical data using machines like force decks, handheld dynamics, just to give us that live information, and also to give our patients or athletes a visual kind of idea of what their body can actually do. And then from that, we can create, you know, training regimes or practices or techniques to just try and say, right, if we do this, hopefully, you know, and we do it over a period of time, we reduce those risks of injuries. And I think when we're speaking about, especially women in sport, especially football, there are even things out there like FIFA 11 Plus or the charity Power to Play link here, which are already just developing warm-ups for grassroots levels or anybody that wants to do them, essentially, to put in religiously into their programs, which has actually shown a massive, you know, half a reduction of ACL injuries going forward. So prevention is key. Fun fact. So there are over 5,000 euphemisms for the word or the meaning of period across loads of different languages. My personal favourite is German. So Erdbeerwoche, which means strawberry week. So strawberry week, like, you know, period. Erdbeerwoche. So if there are any Germans out there,
sorry.
Let's just, can you tell us if that's actually correct or not?
You can critique me. Just want to mention that in some schools of thought, they think, or some people think, that periods should be used as a fifth vital sign. So obviously if you're going through lots of stress and your body wants to kind of reduce that stress, it will stop your periods as a protective mechanism. So, you know, if you're going to a primary care appointment, you're seeing a healthcare professional like us and your periods have stopped, it's well worth mentioning because it can be a sign that something's not quite right. Yeah,
and that's definitely questions that we ask with a lot of, you know, say, runners, long distance runners, and it's a very important one to just look out for, especially if, let's come away from football itself specifically, but, you know, long distance runners, people who are potentially maybe not eating enough, that is a massive sign to say something is not quite right.
Definitely.
And we would thoroughly recommend just seeking some sort of medical professional opinion, physios, doctor, whatever, just to check that out and make sure everything's okay.
Definitely.
All right. Well, thank you, Alice. That was really fascinating, actually. I really enjoyed that. And we just want to hope that, you know, people can take away some of that. It's not, you know, like we said, it's not gospel. It's important to understand this is all kind of limited research and stuff, but it's just things to try to take away and make everyone safer from the athlete to the coaches that are involved to train them, to even us practitioners that might not have even talked about periods and the menstrual cycle as a whole. And yeah, I think it's really important for us going forwards in the future. And just to finish off, go Lionesses.
Woo!
Come on, we're going to do this. High five, plinth high five. Woo! Oh!